All right, hi there, J.R. Lewis with you. Our final daily briefing of the week, Friday, the 4th of December. And we are with you, as always, in the 1, 5, and 8 p.m. hours on the radio, and then uploaded to youtube.com/Cordova TV as soon as Robbie can make that happen. We appreciate his support continuing to get those there. We're speaking with Dr. Sanders today, not because an awful lot has changed locally, but because of this interesting guidance that came out this week from the CDC regarding the length of quarantine. And we want to get the perspective of our local doctor before just assuming that that's something that we're going to see happen as far as the medical professionals' recommendations they make for Cordovans. So, but a lot to celebrate, too, on the dashboard. In fact, we're back down to 0 active cases, which is wonderful. Another threat averted. No hospitalizations either. So, let's talk to the doc on today's briefing on KLAM and KCDV. Dr. Sanders, let's first address the fact that we see zeros in a lot of the right places here. How does it feel to dodge another volley?
You know, I'm always happy to see the cases go to 0. It's not that we didn't have people that had to deal with a lot of, whether it was isolation and quarantine and the mental health issues that can go along with that isolation, or people that were sick and recovered. So definitely this has impacted our community, but it is also great to celebrate that our active cases are now at 0. We really do encourage, if anybody is feeling symptoms, which include fever, body aches, or loss of sense and smell, and the rest of the symptoms that we've been going over for months now, we want people to test early. When they test early, then we are able to identify contacts and get it isolated and stop the growth or stop the spread really quickly. Okay.
So, and I mean, as always, of course, we've always had to temper our enthusiasm for an outbreak being, or a cluster of cases being contained, to temper that with a recognition that there can still be people asymptomatic walking around out there with it. We still need to be cautious. It's not an excuse to let our guard down. I noticed the city hasn't changed the alert level. So, not to make too much of it, but it's also fun to just kind of enjoy those positive numbers when they come through.
Exactly. I definitely do want to celebrate, but the city has the plan in place to hope to not yo-yo things back and forth. We do see the rest of the state and the rest of the country is dealing with large outbreaks. The hospital capacity in Anchorage is starting to be strained. A lot of that has to do with staffing shortages, but there is some strain there, and so we're going to remain cautious and keep going.
Okay. Well, I mean, that's what we've been trying to do for months here. It sounds like a good plan. Now, as to this new guidance that has come out from the CDC regarding quarantine, what do you make of that? Well, first off, what are they saying?
So what the CDC has said is that they do recognize the importance of the 14-day quarantine and the ability for people to become symptomatic and shed virus in that 14-day window is the highest risk time. They have identified that the first 10 days are the most high risk, and 90% of people will develop symptoms within that first 10 days or test positive within that first 10 days. So they have modified the quarantine requirements to make it a little bit easier for individuals and help people be more compliant with the quarantine recommendation. They've changed it to 10 days. If you're a close contact, you quarantine for a full 10 days after you're exposed, and you can end your quarantine on day 11. So it really shortens that quarantine by 4 days. The remainder of the 14 days, though, so those next 4 days, they do ask that you wear a mask when you're around others and continue to monitor your symptoms.
Okay. Now, every time we hear something like this, a new piece of guidance at the national or even at the state level, the first thing that I always wonder is what do our local experts think of how this broader information impacts our community? Is this national strategy or this national suggestion a good suggestion for Cordova, or does our isolation or our population size or what we do for a living or any of that make it so we should be more cautious, as we have done a number of times throughout the pandemic? So to that point, do you see Cordova making some changes in philosophy regarding this, or do we really need to stay the course that we're on?
I think that throughout this, what we have seen is that Cordova has had a respect for the pandemic and a respect for our neighbors. And that's part of the reason that we have seen our cases as they come up, we're able to get them down to zero because people are cautious. I don't think that there's any reason that Cordova won't apply this logic just as we have with any of the previous guidance. I think that going to a 10-day quarantine and still having people remain cautious for the first 14 days will be a safe change for Cordova to make. There probably will be some question regarding the availability of testing, and there is the CDC has put in an option that if tests are plentiful, that individuals could be tested on day 7 and then end their quarantine early after their negative test. Our testing supply is not so significant that we will be able to do that. I think from what I'm hearing across the state and the rest of the country, I think very few places will be able to accommodate that. Most places, if you get a test on day 7, you're still going to be waiting for your results until day 11 or 12. So we're going to continue that 10-day strategy. We're not asking people to come and test at day 7. When you are a close contact, we do recommend that you get tested. The contact tracers and the providers help decide when that test should be done. Sometimes we want people to get tested immediately, depending on if they work in a high-risk setting. Sometimes we ask them to wait. It varies case by case.
Okay. And we've been fortunate, too, that with the size of our community and the responsibility of our citizens, the contact tracing really still seems to work fairly well here, whereas it's pushing its boundaries of usefulness in much larger communities, even in the state, to say nothing of the giant cities, where it's just the spread is so rampant that it is practically impossible.
One thing that makes it difficult in the state is when you have a case that gets tested and maybe their symptoms started 2 or 3 days before they test, and it takes 5 days to get the results. You don't have the results until day 8 of illness for those individuals. So that is making contact tracing throughout the state very challenging. We have been fortunate. We are able to get our tests relatively quickly. Even when we're sending out, we are, for the most part, having results in 3 or 4 days. And we have an excellent group of providers and nurses that are participating and helping do that. Some of that initial contact tracing, it's not as formal as what the state does, but I think most of our cases are having a lot of phone calls from local and state people, and I think everybody does feel very supported here. So Cordova has just continued to do an excellent job with all of this.
Yeah. How are you feeling about statewide hospital capacity? That was a subject you and I talked about last time.
With this pandemic, it has all of us paying attention, because last spring we saw hospitals being overrun so severely in places like Italy and New York. And that certainly catches our attention. However, in a normal year, our hospitals are very full in the winter, and our bed capacity is designed to take care of about the number of patients that we have sick on average. We don't usually have a lot of empty hospital beds. So when I look at the numbers in Anchorage, I do see they're climbing, and it is concerning. But I don't think that is much different at this point than what we see hospital bed-wise on an average year.
Okay. Because, that right after fatalities, hospital capacity is one of the areas that is, sort of indicative of the severity of how we're doing. So any additional thoughts, frequently asked questions along those lines?
No, absolutely. And I agree with you. I'm not trying to downplay the risk of the hospital capacity, because it is something that we're paying attention to. I think we're seeing much fewer hospitalizations for some of the other things we would normally see. And we're certainly seeing the number of deaths throughout the country and in Alaska have climbed over the last few weeks. And that's a concerning statistic, and definitely something that we want to pay attention to.
Sure.
So I just also don't want to be adding to people's fear of the hospital capacity. Right now, the hospitals are paying attention, and elective procedures in some places are being delayed in order to help preserve some of that hospital capacity and preserve really the staffing capacity. That has been one of the biggest challenges this year is for hospitals to be able to maintain adequate staffing.
Yeah, so it's not just about the beds. It's about if you end up with sick staff exposed to sick people. Yes,
that's been a huge challenge this year, both here in Cordova and everywhere. So,
yeah. Well, again, is there anything that you get asked a lot that would be nice to tell more than one person, or do people kind of seem to understand the ebbs and flows at this point?
I think people understand the ebbs and flows. It seems to be going well. We always like to bring visibility and awareness to just how challenging it is to be asked to quarantine for 14 days when you are a contact. And I want to encourage people that have been through that to call and support one another and use the mental health services that we have here in Cordova, both at Alanka and Sound Alternatives. I think that it's kind of a very large, unspoken challenge, the significant mental health impacts and the impact of quarantine and isolation on individuals it's really challenging. And you have a community supporting you. Make sure that you reach out to one another. We've seen those impacts of that isolation in our long-term care, and I have the staff at the hospital are doing amazing jobs trying to create ways to celebrate the holidays and keep people in touch with their loved ones. And I just want to thank the community for all the letters that they've been sending and some of the wall decorations to the long-term care. I think everyone's doing a great job trying to support each other, and let's keep doing it through the holidays, and we'll get through this year one way or another.
Yeah. Well, and I don't remember who sent me the email about it initially, but that Pen Pal program for the long-term care, I thought that was a brilliant idea, just like all the great ideas that came up through Halloween, and we're seeing some of that happen already for the holidays with virtual tree lightings and safe ways to shop and that kind of thing. So it just makes you glad to be part of this community. Doctor, thank you again so much for the time. Really appreciate it.
Thank you.
Always educational. Our visits with Dr. Sanders on the daily briefings on KLAM and KCDV. If you joined this in the middle at some point, remember they also go online to our YouTube channel, youtube.com/Cordova TV. Congratulations again on folks for responding when we saw our case counts climb and turning it around the other direction, not letting the virus just get rampantly loose. Of course, we do need to consider that it is almost certainly lurking around somewhere in the community among asymptomatic folks, and continue to be cautious. The level 4 warning is still in place, as we mentioned earlier in the show. And if you have any questions, then you can reach out to the city through that dashboard website, City of Cordova, or it's covid19.cityofcordova.net. 424-INFO is the phone line to reach folks at the city who can take questions and collect thoughts and opinions. And 424-WELL, provided by the Village of Eac, with the pre-recorded announcement, including some of the latest information for what's going on in the community. We'll see you next week in the 1, 5, and 8 p.m. hours on the radio, and whenever on youtube.com/Cordova TV. Have a great weekend. Be safe. Thanks for tuning in, and we'll get you back to regular programming.